While advances in skincare are all the rage, rates of skin cancer are on the rise. The good news is that this is most likely from a combination of people living longer and better detection. Basal and squamous cell skin cancers are increasingly common, but so are successful treatments. We went on the local scene to learn more from Dr. Nossa of Contemporary Dermatology in Plymouth.
I'm Robert Nossa. I'm a board-certified dermatologist. I'm the founder of Contemporary Dermatology, and we have offices in Marston's Mills on Cape Cod and in the Pine Hill section of Plymouth. So melanoma is a malignancy of the skin that's caused through the transformation of pigment-producing cells that are normally producing pigment and quietly sitting in the skin through UV damage evolving into a progressive skin cancer that can be life-threatening if left untreated. Underlying causes for melanoma include chronic UV light exposure, so ultraviolet light exposure through sun exposure or through tanning beds will place you at higher risk for developing melanoma. Additionally, fair skin, light eyes, light hair are patients who are genetically at higher risk for developing melanoma compared to darker populations. Additionally, family history for melanoma will place you at a higher risk for developing melanoma, as well as a personal history of melanoma. Having had a melanoma places you at a higher risk for developing future melanomas. Finally, I would consider age as a risk factor, as the older that you get, the higher the risk for developing skin cancers as well, including melanoma. The skin cancer rates in Massachusetts are highest in the nation. I would say it's threefold. I would say one, it's the population that we have that are generally lighter skinned, Northern European descent, with higher risk factors for developing melanoma. And this population may be spending more time outdoors, more UV radiation. You know, we have a coastal lifestyle, so many of our patients have been sunburning repeatedly over many years. And then finally, I would say it's the age. Older patients tend to develop more skin cancers, and our location around here does tend to have a slightly older population. So patients could recognize a melanoma on their skin by looking for moles that are irregular in shape, color, diameter, and moles that are changing. We use an acronym called the ABCDEs of melanoma, where A stands for asymmetry. So a mole that is not oval or round, that you can't fold in half into itself, would be an asymmetric mole. Irregularly bordered moles, where you can see pigment kind of fading from out the mole to the surrounding skin, would be an abnormal sign. Moles with multiple colors, moles that are light and dark with variegations of pigment, including areas of depigmentation, would be moles that could be suspicious for melanoma. Moles that are large, or D diameter, greater than the size of an eraser head, would be a mole that would be suspicious for a melanoma in combination with the other signs. And then E, evolution, a mole that is actually changing in shape, size, color, or becoming symptomatic, bleeding, or becoming painful, would be something to consider. Tips that I would recommend to aid in the prevention of melanoma would be, one, most importantly, protect yourself from excessive sun exposure. So if you're going to be outdoors for excessive periods of time, find shade to protect yourself. Use UV protective clothing that protect both your arms and your legs. Using a broad-brimmed hat that can protect your face. Using a high SPF sunscreen on a regular basis. And if you're going to be outdoors for excessive periods of time, so reapplying at 2-hour intervals, especially if you're sweating or swimming. In addition to that, getting to know your skin, doing self-exams, looking for any moles that might seem atypical to you, and then seeking the help of a professional dermatologist for routine skin evaluations, especially if you're a high-risk individual. When going in to visit a dermatologist for a full skin cancer screening, know your own skin before the visit, maybe by doing a self-exam with a handheld mirror and a full-length mirror, and identifying moles that you personally might feel are atypical and irregular, and selectively point those out to your provider. In addition to that, you should ask questions about preventative things that you can do to reduce the risk for developing melanoma. And if there is a suspicious lesion that is biopsied, talk about potential diagnosis and therapeutic options depending on the diagnosis. The emotional impact that I've seen in patients that have been diagnosed initially starts with often shock and disbelief that a mole that could be so small and innocuous could have such a heavy diagnostic perspective. Based on the thickness of the lesion, prognostically, there's always a risk of evolving disease, so that can lead to anxiety, depression. Then there's the body concerns about scarring that can occur from the excisions that are required, the surgeries that are required to correct and to remove a melanoma. And then understanding the uncertainty of the future. If a deep lesion is removed and the prognostic possibilities associated with that. It's important to have a month dedicated to melanoma awareness because it gives us the opportunity to educate our population on preventative things that we can do to avoid developing skin cancers and to educate ourselves in how to identify early lesions, to diagnose and treat skin cancers in their earliest form when they're the most treatable.
Thank you for watching. If you enjoyed this video, please hit the like and subscribe button before you go. We'll see you next time.